is your favorite summer food?
Do you want to go first, Robin?
I'm happy to go first because I've actually thought about this quite a bit. So there are easy answers. Watermelon, right, is high. Corn on the cob is a great one. I'm gonna go with rhubarb. And I said this to someone else because the other things, if you try hard enough, you can get them at any time of the year. But rhubarb is one of those things, it's not that popular. So like you can't get it from your grocery store in January or something. You've basically got one chance in the year to eat rhubarb, and that is like June. So that's why I'm saying the dark horse favorite summer food should be rhubarb.
What does everybody else think about that?
And it's good. So
Natalie, what are you gonna say?
Oh no, I was just laughing at how passionate he was about rhubarb.
well, you gotta, when you're making your argument, especially a controversial argument, you've got to have, thought out. You got to have some reasoning behind it. So,
Okay, Robin, but can I push back and ask, have you ever had rhubarb without added sugar?
never.
Exactly. Right? You have to like sweeten it up because it's not like sweet on its own.
Yeah. Yeah. You would never cut a stalk off and just take a bite out of it. No.
Not like corn on the cob, which you can just clean the worms off of it first and then gnaw into it right away.
Well, I didn't know that prep was a part of the decision-making process.
What is Chelsea? What's your favorite?
I'm probably one of those basic people that says watermelon. And quite frankly, if I'm being honest, I don't think I've ever tried rhubarb. So don't hate me for trying or for saying that.
Isis, what do you think?
I think I have a lot of fruits that I like, but I'm gonna say oranges, maybe. Yeah, I like to peel the orange and just eat the little pieces, and they're sweet at that time. So yes, that would be for me. That would be for me.
Especially like a cold orange on a hot summer day, like the sugar and the coldness and all. It's so good.
That's delicious. And then sucking it too. So yeah.
Right. Bonnie, what do you think?
I don't know. I have ate rhubarb raw. My grandpa had a great big rhubarb patch in Montana, and we would just peel the skin off of it and put some salt on it and just eat it raw. But the best way to eat rhubarb is with strawberries in a pie. But I like all of the other selections also.
Robin, I gotta be honest, rhubarb, I'm not a fan at all. I don't know, even with sugar on it, I'm like, okay, it's fine, but it's not, it's not, I don't know. I don't know if it's special.
Well, thanks for your opinion. You're wrong, but it's nice to hear your thoughts on this.
If it were me, I would say, I have to go with what I think of summer is snow cones and that kind of stuff. Like fruits and vegetables in the summer, strawberries, right? Like the super, our students and Movemore Get More, they love the super sweet fruits, and that's just it's the taste of summer, right? Even though I don't like watermelon because it is too sweet, and it's the sweetest fruit ever, right? As it doesn't have more sugar, isn't that right? Watermelon has more sugar per volume than any other fruit. I think so. I don't know. I think we missed Simone. Simone, how you doing?
Good. Are we introducing ourselves?
Sure. What's your favorite summer food?
I don't even know. I am expecting, so I don't, food from day to day is, touch and go.
Congratulations. I didn't know that. That's news.
Thank you. So I would say potatoes, if that counts as a summer food. French fries.
I mean, they're delicious, right?
Yeah.
It's a vegetable. So,
Yeah.
funny, good stuff. Okay, Katie, do you want to add any input to the conversation?
I like mangoes, but I like frozen mangoes a lot in the summer. I snack on those often. So that's my favorite summer food.
They're so good, especially like Caribbean mangoes when you're on the beach and you get like, they're so juicy, and it like starts running down your arms because it's so good. But touche.
I think Natalie's left.
I guess, I have a lot of friends that forage, so we did gooseberries recently and now blackberries are coming up.
That's fun. That's very Missouri, right? Like, isn't it? Don't you like grow that stuff in Missouri? I don't know.
Yeah, they're just native grown wild.
That's awesome. All right, Katie. lead us away.
Yes. So we left off talking about the national plan strategies and which ones we kind of wanted to focus on for Kansas City, but we never finalized that. So we are going to decide what strategies we want to focus on. And based off the last 3 meetings, we talked about only focusing on 3, but we can discuss that further. Do we want to focus on 3 of the 6 strategies, or do we want to focus on all 6? So it's open for discussion, and I will go ahead and share my screen to give you a refresher of how we ranked these.
Yeah, I think this is a really good conversation to have, guys, because we mentioned 3, and maybe that was just me back in the day, Katie, do you have the language of the 6 somewhere?
Yep. So
Um,
I'm dropping the link actually into
Yeah,
the
that works.
chat.
So, yeah, so to Katie's point, Katie, I don't know. Okay, yeah, so you have the ranking, and then we have the language in the chat, right? So if anybody wants to bring that up. So I think we have to decide if we want to focus on all of them, if we want to focus on a few, if we want to change any of them. All of that's kind of open to discussion today. What are you guys' like immediate thoughts or reactions? I'll kind of kick off the conversation if that's okay with everybody. I think when we said 3 before, I think that was maybe just me being like, let's kind of focus in and get some stuff done. But I think last time we had some really good conversation around like public health workforce stuff, which I think is strategy 1. Strategy 1. And that's like last on the list. And so I would hate to not have that one on the list when I think it's something manageable that we can focus on too, Robin?
Well, I was just gonna say, and I don't think I was at the last meeting. I think I was traveling or something like that. So, I missed out on maybe what you guys had already discussed. Just from the broader KCPA plan perspective, we've had some sectors who have done similar to what you're talking about, just saying, hey, let's do the top 3 and drop the bottom 3. And it came back to bite them later, like 6 months later, a year later, a year and a half later. Some new people join the sector and they are super interested in something that got dropped during this part of the process. And so I think that my recommendation would be to keep them all. But it's certainly okay to say, you know, these 3 rows were the clear cream of the crop during the planning process. So we think these should maybe, you know, considered first. And then the second ones would be considered second if new opportunities come up, something like that. So
I think that's really good feedback to have, Robin, because that's what I would hate to, you know, in, you know, 2 years or something, get to the point where we could, or, you know, there's kind of some natural synergy to impact one of these things and we didn't include it, right? What do you guys think about that? Chelsea shaking her head, yes. Yeah. Does anybody have, I mean, can we just take a quick poll? Does anybody have any objections to including all 6 strategies and we can focus on tactics today?
I think it's a good idea to include all 6.
All right, easy stuff. Do we want to, I guess, Robin or Katie, do we want to like look at the strategies and see if we need to like, you know, adapt them to Kansas City real quick? So why don't we do that? Why don't we take just a few minutes here and look at the strategies and see if there's anything we need to adapt to Kansas City. So let's just go down the list. So strategy 1, public health organizations should develop and maintain a workforce with competence and expertise in physical activity and health, and that has ethnic, cultural, and gender diversity. The only thing I would maybe potentially suggest here is talking about like collaboration, right? So I don't know if that's like strategy 2, because I think the strategy 2 that talks about like multi-sectoral collaboration, but maybe public health doesn't have to have the expertise within the organization, but they can partner with other people who do. It was part of our conversation from last time. Do we want to, what do you guys think? Should we try to include that in the language or?
So that almost seems like a tactic to me, right? Like, you know, the strategy is you want to have this expertise, right? And then a tactic would be, you know, and I'm just totally winging this, so it could be wrong, but, you know, partner with UMKC School of Nursing for a annual physical activity 101 course, you know, something like that. Yeah.
I like that idea too, Robin. I think that's great. Anybody have any objections to that? Okay. Strategy 2, Katie, and I think this is where I look on.
Can I just, I'm just going to do a quick plug. I think I may have mentioned this before since we're on this strategy. There is a physical activity and public health workshop short course that is happening in September at the University of South Carolina. It's funded by the Centers for Disease Control and Prevention. It is a great course. I've been, Katie's been, Natalie's going. And I can't remember when the deadline for applications are. Natalie knows. But if there's still time, strongly consider anyone on the call to attend that this year. And if not, oh, it was June 1st. Okay, so we missed it, but Natalie will report back what she found. And, you know, we should maybe even think about that as a tactic, you know, like encourage, you know, Kansas City Health Department employees to attend the physical activity and public health course, something like that.
Katie, do you have those 2 notes written down somewhere? Because, you know, I'll forget. Okay. Strategy 2, guys, and these are like not labeled well in here, but it's fine. It's the one right above tactics. So public health agencies should create, maintain, and leverage cross-sectoral partnerships and coalitions that implement evidence-based strategies to promote physical activity. I think that's a great one. I don't think there's anything that needs changed. Anybody else? Okay. Number 3, nonprofit public health organizations should engage in policy development and advocacy to elevate the priority of physical activity in public health practice, policy, and research. Again, I think it looks good to me. Okay. Please, anybody speak up if you have any other words or want to discuss anything. Always open to anything. Okay, strategy 4, public health agencies should expand monitoring of policy and environmental determinants of physical activity and the levels of physical activity in communities, i.e. surveillance, and should monitor implementation of public health approaches to promoting active lifestyles evaluation. So surveillance and evaluation. It's nice that these are written by really smart people, so we don't have to do anything, right? Anybody on this one? Nope. Katie,
That's what I was thinking, Joey. I was like, these sound really good as is, like, and they're
Yeah.
not like too far off of what we can do, so.
Yeah, agreed.
Maybe we've talked about it before, but if not, like I just was looking at this yesterday for a webinar I gave. So the process was, there was like an expert panel that came up with the evidence. Then they wrote out this very well-written strategy. Then it went to the public for vetting, and then it came back to the committee for further review. So like there have been like multiple steps in the process over like years. So yeah, it's not an accident that they're as good as they are.
Number 5, Katie. Public health organizations should disseminate tools and resources important to promoting physical activity, including resources that address the burden of disease due to inactivity, the implementation of evidence-based interventions, and funding opportunities for physical activity initiatives. I want this one to be shorter. Does anybody else feel that way? Like for me, it could be like just disseminate tools and resources important for promoting physical activity, period. And then the rest of this stuff could be tactics, but it could just be wanting conciseness. Because I think if we, so in my mind, I'm thinking about implementation, right? And if a group comes to me and they say, hey, we want to, I don't know, disseminate these things for health departments and public health entities, I don't know if it would really matter what it would be, as long as it's evidence-based, stuff, and seems to work, and the committee likes it, and all that kind of stuff works, right? But beyond that, like we're talking about like benefits of physical activity in that first point, right? Resources to address the burden. Well, maybe not just benefits, but implementation of evidence-based approaches. I guess I always get hung up on that, like funding opportunities for physical activity initiatives, because I don't want people to think that they have to. I don't know what I'm trying to say here. Anybody else jump in?
Yeah, I kind of get what you're saying. To me, it almost reads like public health organizations should like create a resource bank, period. It should include information on the disease burden. It should include information on interventions. It should include information on how to get funding to do it.
That's it, yeah.
So we just talked about how well written these were. This one, they took a nap. They gave it to an intern. The intern didn't do a very good job. Something like that.
I agree with you, Robin. I think like making that first sentence, period, and then this is how we're gonna do it. I like that because that looks very wordy and like there's a lot of big words in there.
So what do you guys think? Katie, would you be willing to take a first stab at the kind of wordsmithing this to make it better? And then next time we can vote on, you know, what that looks like. Or obviously I'll give some input too before next time.
More than happy to.
Okay. So guys, look for that next time and we'll kind of clean it up. And then strategy 6, public health agencies should invest equitably in physical activity commensurate with its impact. I mean, I think that's appropriate. I think it's really hard, but like, you know, we've all said in the past, but I think it's an appropriate strategy. I think it's written well, gets to the point. Cool. So minor change to that one, but the rest of them kind of look good. Super. All right. Tactics, Katie.
Yep. So I'm going to drop a link in the chat and I'm going to explain what we're doing today. I'll start with explaining. So kind of similar with what we did with the strategies. So the national plan, like it essentially has these 2 levels of planning, the strategies and the tactic level. And so the strategies, which we just discussed, are these more broad ideas where the tactics are more these specific objectives to accomplish the strategies. So we're focused on tactics today. And for the public health sector, there's 5 to 6 tactics per strategy. So we're ranking them so we can continue discussing which ones we want to focus on. And I know Robin's had experience in this more than I have. So some of the other sector groups didn't do all of the tactics. They decided to focus on like 3. So after we rank them, that's what we'll go ahead and discuss, and we'll do that on Jamboard.
So there are a lot of tactics because there's like, I know one of them has a ton, right, Katie? Like tactic 2, I think.
16, up to 16.
Oh, that's a lot. So why don't we do this? Why don't we take a couple minutes, guys, and when you're done, just like give a thumbs up, but have the Mentimeter open and then do strategy 1. So again, strategy 1 is about workforce. So I have it open on mine. I think, sorry, yeah, Kitty, you can click through. Sorry, I already have. Kind of
Yes, you're good. So again, just a brief reminder, we're focused on tactics. They represent the specific actions used when applying a strategic choice. I apparently had it twice. I would like to say for some of these, what we discussed, like we have the one that has 16 tactics, we won't be able to vote on all of those tactics on one slide. So it's 2 different ones. Mentimeter only allows you to do 7 choices at once. So just heads up, don't get confused later on. But so we're starting with tactic 5 based off the ranking of the strategies. So we'll start with tactic 5. And what you're going to do is you're going to rank which tactic you feel is a priority for Kansas City.
Okay, so remember tactic 5 is to public health organizations should disseminate tools and resources important for promoting physical activity. So, and I guess to Katie's point, like keep each one of these independent, right? So instead of voting on them as like, you know, a ranking structure, I think that we like for each one vote on it by itself, right? All right, so let's, so when we vote, Katie, it'll pop in, right?
Yes,
Okay,
you should see it.
maybe it doesn't just use just one. Somebody else has to vote on number 1 too.
There we
There we
go.
go.
It just takes a second.
Okay, so let's go ahead and go through this, guys, for everybody. And then when you're done, just give me a thumbs up and we'll move forward. How about that?
And if you need a refresher on the strategies, unfortunately, can't pull up 2 screens at once right now, but there's the national strategies link in the chat already. So just use that for reference.
And Katie, you can see behind the scenes, right? How many people have submitted their responses? Cool.
Yep, we're at 4.
Cool. We have 7 people. 6, 7, 8, 9. Okay.
Simone, you had a question?
I think she was
Okay.
given.
I was trying to find the thumbs up.
Oh, gotcha. Okay. Give it just a couple more seconds to move on, Joey.
Is everybody done, Katie?
No, we're at 5.
Okay, let's give it a couple more. If you guys haven't submitted it yet, we can have a quick conversation around this too while you're finishing up. Looks like 4 is a little low. Identify and support expansion of culturally salient tools that build upon community assets to promote physical activity of all populations. What do you guys think? This is all for strategy 5, right, Katie? There's no anymore.
Correct. This is just, yep.
What do you guys think about just including all of these? Is there any comments on whether we should include all or not include all? My vote would be to just include all of them since we're all ranking them pretty high. There's not like one that like, or 2 or 3 that kind of fall out of the group.
They all seem pretty relevant.
Cool. Any objections? All right, let's move on to the next one. Strategy 4. And strategy 4, again, just so we're all on the same page, public health agencies should expand monitoring of policy and environmental determinants and the levels of physical activity, so surveillance and evaluation. So go ahead and read the tactics for strategy 4, which on my screen are tiny, but we'll figure it out.
Okay, I was trying to split it so I could see my notes again, but that's okay. And just as a reminder, this is going to be one that is split. So we'll cover the first 5 on this slide, and the next slide will cover the additional 5.
I'll just make the comment for number 4, tactic 4. It says develop a national report card. Obviously we're not going to do that. So I would say regional report card. And so just as you're thinking about it, change the word national to regional. And then my second comment on this one is we're already doing it. So it's something that, is like a low hanging fruit type thing. So.
Easy wins are always good, right? So this is really interesting, and like maybe we should have a conversation around this. The second tactic is really low, and just so we're all on the same page, it's to define a common framework to evaluate policy and environmental change processes, outcomes, and impacts. I rank that low, and I know why I did it. Why did other people kind of rank that lower?
I'll just say I ranked number 1 and 2 low because, like, especially public health practitioners, but just about everyone, we're too busy to create like new stuff. And so I'm all about, just taking what has worked elsewhere. And so that's why number 1 was very low, and number 2, maybe we can take something from a framework from somewhere else, but I still kind of thought that seemed like a big task.
What did other people think about that?
Yeah, I may be like interpreting this incorrectly. I think I went a little higher on number 1 because I do think there is a gap in collecting data for diverse populations. And I think we don't, like Robin said, we don't need to reinvent the wheel, but I do think that we need to advocate for better data collection among diverse populations. So, you know, however we might think to do that, I think would be really important.
Yeah, that's a great point. And like, I totally was focused on like the first three words. And that like kind of lost me, but you're exactly right. The latter part of the tactic is super important.
Yeah, especially for Kansas City, you know, I mean.
So I mean, I don't know how other people feel about this. I would much rather have good collaboration between academics and practitioners than have one framework to fit everything, right? Because like social ecological model is great and it fits a lot of different things. It's very actionable, right? But depending on the intervention and the population and the things that we're like looking at, not all there's a how do I say this? Not all frameworks are created equal for every problem, even within physical activity, right? So that's where my mind was, in that like, if we're really focused on implementation, we should use an implementation framework compared to like changing, like if we're looking at outcomes, you know, like population health outcomes, that's a different framework than like implementation outcomes, I think. And so I'm less concerned about using one framework for everything than getting the job done, you know? Does that make sense? I do like the idea of a common set of measures, but we know that, like, if you look at the IPAC, right, it's a terrible measure for most people. And I don't, there's not one good way to do things, I don't think.
So this it seems like might be a way or an opportunity to like maybe, you know, there's already 10 tactics, that's a lot, but maybe splitting up like this first one, so there is a specific tactic focused just on, you know, making sure that diverse populations are assessed. So I think everybody agrees that's important. But then take out the set of measures part and maybe rephrase that like what you were just saying, Joey. Just an idea.
Could you maybe combine it with number 9, like expand the relevant local surveillance that's already happened and add that to the end of that one? About the diverse populations?
So Natalie, it would be something like create and expand relevant local surveillance or other physical activity data collection systems that can be applied across diverse populations to track progress on physical activity promotion at the local level, regional local level.
Maybe, I don't know if it flows that well, but it just seems they're kind of similar already. Those two tactics.
I don't disagree, that's for sure. What do you guys think? Chelsea, Isis, Bonnie?
That sounds like a good idea. Like that idea.
So I guess, Katie, do you want to take a stab at trying to, you know, collapse 1 and 9
Yes, I can do
for
that.
next time? And we can kind of vote on it and wordsmith next time on what that one would look like. And I think it does belong, I think that belongs in the beginning, right? Surveillance, like tactic 1 or whatever. Surveillance, especially among, you know, diverse groups, needs to be it's a key thing that we should be doing. Cool. Let's move on to the next 5, yeah? So
These are the last 5 of strategy 4. So starting at 6, expand surveillance systems. While keeping in mind what you just talked about with tactic 9.
Okay, Katie, tell me when we have, you know, the majority of folks.
Yeah, give it a few more minutes. Only 3 people have gone.
And back to Robin's comment about, you know, local and regional stuff compared to state and national. I don't know, is national in here? Yeah, it is in there. And number 8. The 8's a weird one. I didn't quite know what to do with 8. I don't know how other people felt about that.
I feel like 8 would be hard. I mean, it might, we probably need to do it, but it'd be hard to do, I think.
Well, especially Missouri, where like, you know, if we're talking about, you know, linkages between local policy and environmental change and like state stuff, you know, the state's non-existent in terms of these kind of things. Kansas is not great, but it's better, I think.
Okay.
You're good to go.
Yep.
So I think we all rank these pretty high. I think we should all keep them in. Comments on that? We want to talk about wordsmithing, like 8 at all, or any of these others besides 9, which we kind of already talked about. Just want to keep 8 how it is.
I mean, I think if we're identifying that there's a gap between the kind of state data already, then we may need to kind of might we first work on that before we try and link.
You say that's a good point.
Yeah, I mean, because our states aren't really doing a great job of collecting that kind of data at all. So we might need to think about how we want to impact in that area before we make changes, or you know, because we can't, it doesn't exist.
I mean, the other option is like we leave it in, right, and use it as an advocacy tool for the states, being like, hey, states, you know, we need you to do these kind of things in order for us to be able to impact our stuff as well.
I was kind of thinking about not the state, because I don't know the state nearly as well as you guys. I was thinking about local policy and local data collection. And Joey, I was thinking specifically about the bike walks data that we saw looking at bike and pedestrian fatalities geocoded in the city. And like and then my mind would go straight to the city's Vision Zero plans. And so like collecting that type of data, sharing it with decision makers so they can prioritize environmental changes in those areas. That's a pretty specific example, but I could maybe come up with some others like sidewalks, like, hey, do you want to improve, you're trying to replace sidewalks. Here are the places with low rates of physical activity. Maybe you should prioritize sidewalk replacement in those census tracts or something. So that's kind of where my mind went with number 8. But
And I think that kind of stuff is doable, Robin, right? Whereas like if we're relying on state stuff to do anything, then like it's not, you know, I hate to say it, but it's kind of out of our hands. And so we got to move forward. So what if for number 8, guys, we change state or national and state data collection systems to either local or regional? Yeah. That way it really does hone in on, you know, Kansas City. We can like do what we can do here and then not have to worry about that other stuff. Are we missing out on anything national, Robin, or anybody else? Simone, maybe? Like, is there any like, would that be like, I don't know, collaborations with the CDC that then we're like not thinking about, or do we just move on because like we can actually get something done here, you know?
I think that even, I mean, the CDC data isn't great either, depending on what you're looking at, in populations. So I would think if we could get better data locally, then that would make sense, at least for our purposes.
All right, so we're changing this to local and regional data and really focusing in on our stuff. I think that makes it so much clearer, don't you think? I think that's a good point. Okay, Katie, let's move forward. Which one's next?
So there are 16 and 3. So this is the first 8.
All right, so let's do these 8 guys. And remember, tactic 3 is nonprofit public health organizations should engage in policy development and advocacy to elevate the priorities of physical activity in public health practice, policy, and research. So plenty of stuff to do on that front, right?
This one's so weird because it talks about federal stuff and you know, there's not a lot of equivalent local agencies that I'm aware of to like just, you know, oh, let's swap out CDC for, you know, something else.
Yeah, I was trying to think of the same thing, Robin. Like, we don't have any of these like not one health department is the leader in any of these, right? I think there's one health department that does a better job in physical activity than the rest, but they don't have an office of physical activity or like a center or something like that, right? What about like, I hate to say it, but like, what about Healthy Lifestyles Collaborative or, you know, those folks? It's not like a public health organization like we've been talking about it, but I guess the other option is, guys, we could scrap all the stuff that's like very specific to federal level policy. I think number 5 fits well, right? Using the evidence-based, you know, physical activity guidelines as an advocacy, you know, everybody should know them. It's an easy thing to do. But the rest of them.
Yeah, the only ones that I kind of would say is maybe 7 and 8 and just swap out like federal funding with like local funding. And we've made some efforts. The KCHLC has made some efforts to do this, to meet with funders, say we need more physical activity funding. So I think that there is a big need for that in the region, and having health departments, you know, be involved with that, I think would be good.
Yeah, I don't disagree, Robin. I think that's a great point. Especially number 8, I think number 7's good. I think it's easy and, you know, we can, I don't know, not easy maybe, but appropriate. I think number 8 is really good. Engaging decision makers and, you know, funding research on policy development. So what if we scrapped all of the like 1 through 4 and 6 and we kept 5, 7, and 8? Chelsea's like, yep. Robin, Katie, Simone, what do you think? Yeah. Isis?
Good idea.
Bonnie's on board. All right, Katie, make that note. And yeah, let's move on to these last 8, I think, right? Okay.
We're at 4, we're waiting on a couple more people.
Yeah, sorry, I was it take a long time to read, guys. So there's a couple in here that I think are really interesting. So what we have to decide which ones we want to keep out of this list, which ones we want to get rid of. I think that most of these fit Kansas City. What do you think, guys? 14's a little low. So I thought 14 was really interesting because create an interdisciplinary policy and advisory center to support advocacy efforts and policy development. So I think of this as like, you know, what we did with Tobacco 21 in Kansas City. So Tobacco 21 was, you know, for the public health folks, you guys know this, but I think for the academics, was this major initiative to like get all of the cities on board. And you start with Kansas City, Missouri, and you like, you know, cobble away at all of these cities in order to get the entire metro to, you know, have Tobacco 21 policies. And so that was, I think, a really good initiative. And I think that there was a core group of people who really kind of like led that and, you know, like had the vision to think through, let's start here, let's go here, 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 and, you know, like, and move forward. And if there was a group that could do that for physical activity policies, right, that could be, I think, really impactful and kind of a lesson learned from tobacco, which is like, you know, what we all should be doing.
That, I think that's a great idea. Like, who was the Tobacco 21 group that was driving that?
It was, I mean, you know, it was like the Tracy Russells of the world, right? So like AHA, Archer, Rex Archer was part of that, right? And like several other folks, but they did it in a really systematic way that like made it happen, you know? I mean, I could see that with like Complete Streets or Vision Zero or, you know, transportation policy, that kind of stuff I think could be done, but it's, you know, it's always a mess, but.
Yeah, was it kind of an ad hoc group then? It wasn't like,
Yeah, it wasn't supported by any kind of like federal funding or anything, right? It was like this group of people really cared about, you know, stopping smoking and they pushed it forward. So.
cool.
So I want to be mindful of time. We only have 4 minutes left. So let's get these tactics done. I think we should include all 8 of these. What do you think? Are there any we do not want to include? And if the 14 is not, that's the one that's ranked the lowest. So if it's, you know, if other people don't want it, we don't have to have it in.
I agree with you. I think we should include them all.
Going once, going twice. All right. So Katie, we have 3 left. 2. How many do we have left? Do we get through 3 today?
We
Yeah.
have three.
Okay, so we have 3 left, guys, and they're shorter, right? There's not 16 of them. So, so I guess next time, let's really focus on those. And then we should have our strategies and tactics done, and we can start moving forward on what's after that, guys, implementation.
Yeah, so what we'll end up doing is we'll create the pages that will go in the KCPA plan. And that's something, so we might skip a month and focus on that, and then we can start on implementation. In the meantime, when I send out the next newsletter, I know that we already had one go out for June. I'm gonna stop sharing my screen. I'm going to send another one. It'll be shorter than the first one, but I'll include a link to this Mentimeter. So if you want to get a head start and start voting, you can do that. And so that way we can focus on the Jamboard and kind of just really diving into these tactics a little more. And it gives us a moment to also refresh. And maybe next time we decide, like this one we just voted on, maybe we don't want to include 14 or all of those tactics. But that's it. And then guys, we're done with all of this and we can move forward. So Robin, your hand's raised.
Well, I just wanted to say, you know, you guys are, and we are all at the kind of the near the end of this process. And Joey's exactly right. It's never too early to start thinking about implementation. And so I can't remember if I've shared this before, but we have $15,000 per sector to fund implementation projects. And just given, you know, the timing it takes to like identify potential projects, developing what they're going to look like, how they're going to work, it takes a couple months as well. And so like, I think it's okay as you guys have time to start the process, you know, maybe next month. So. And if you want the money, if you don't want the money, we'll just send it to the other sectors, but it's 15 grand. So, and what if needed, I can share additional information about that to the group about, you know, what types of things are fundable, what's been funded, what's already going on, all that stuff.
Yeah, so I mean, when I think about, oh, sorry, go, Katie, go ahead. So we don't have a minute.
No, go ahead.
So when I think about looking at these tactics, guys, my brain is like thinking, who can do this and how do we like, you know, push them to you know, do some of this work, and how do we fund it? I think that's all that stuff is super interesting. It's 1 o'clock. I want to be mindful of time. Thank you all for all of your hard work and, you know, collaboration and input here. Really valuable stuff. And let's get these tactics done for next time, and then let's start pushing implementation and figuring out how to actually make a difference.
Yeah, so just a reminder, the next meeting before you guys jump off is July 20th at noon. That Eventbrite will go out here right after this meeting, okay?
Thank you all so much. Have a great day.
Yeah, go eat some rhubarb.